अस्सलाम वालेकुम वरहमतुल्लाहि वबरकातुहू। आज हम डिस्कस कर रहे हैं हिस्ट्री ऑफ पब्लिक हेल्थ। तो पब्लिक हेल्थ क्या है? बेसिकली द साइंस एंड आर्ट ऑफ प्रिवेंटिंग डिजीज, prolonging life and promoting physical health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, the education of the individuals in principles of personal hygiene. The organizations of medical and nursing services for early diagnosis and preventive treatment of diseases and the development of social machinery, which will ensure every individual in the community a standard of living adequate for maintenance of health. Understanding evolutions. Those who fail to read history and are destined to suffer the repetition of its mistakes. In studying history, we are able to understand how our predicaments is similar to someone else who came across to us. We might also be able to examine what they did and assess if this is a path that we want to take or something we wish to avoid. Studying history connects us to something larger than merely subjective consciousness. Introduction. From time immemorial, man has been interested in trying to control disease. The medicine man, the priest and herbalist and the magicians all undertook in various ways to cure man's disease and or to bring relief to the sick. It has been truly said that medicine was conceived in sympathy and born out of necessity, and that the first doctor was the first man and the first woman the first nurse. Ancient era of medicine and primitive medicines. As centuries rolled on, civilization emerged in various regions, each civilization having its own characteristics, culture, and lifestyle. Every civilization had a different hypothesis on health. Health was considered as a state of balance between various humors of human body, variously defined by various cultures. Diseases were believed to result from a state of imbalance caused by disturbances in the relative proportions of these humors. Certain theories of the ancient era of medicines. Demonistic theory. Individuals suffering from disease were possessed by demons. Demons were usually evil. Fatalistic theory. God rewards or punishes individuals on basis of their good and evil deeds. Charms theory. Good spirits bring health and prosperity, and evil spirits bring up upon wrath. Miasmic theory. The toxic vapor or miasma emanated from decaying and in animal and vegetable matters are diffused into the surrounding and spread all sorts of diseases. Contagious or germs. This theory held that epidemic resulted from transmission of germs. Spontaneous generations or abiogenesis was originally pronounced by Aristotle, who believed that living organisms directly emerged from non-living organisms. Later, the theory was displaced by theory of biogenesis. Life originates from life by Louis Pasteur. Hippocrates, 460 to 735, introduced scientific methods to the study of medicine. His famous oath, the Hippocratic Oath, has become the keystone of medical ethics. Hippocrates will always be regarded as one of the masters of the medical art. Evolution of the community medicines, preventive medicines, definition by Leville and Clark. The science and art of preventive disease, prolonging life, promoting physical and mental health and efficiency. James Lind conclusively showed in 1748 that scurvy can be prevented by the use of fresh citrus fruits and vegetables. Edward Jenner discovered smallpox vaccines. Thus, the concept of preventive medicines came, and the scope of preventive medicine was broadened from the journal's measures of health promotions, hygiene to specific measures of disease prevention, immunizations. Community medicine. With the emergence of non-communicable diseases and due to their multifactorial etiology, the concept of multifactorial disease causations came into vogue. So, measures like early diagnosis, identification of risk factors, limiting the development of disability, and rehabilitations of handicapped persons were included in the subject. Thus, the scope was broadened from hygiene, public health, prevention and social medicine, and community medicine. Pioneers and milestone events of public health. John Grant, 1622-1674, the father of demography and descriptive epidemiology. The first solid use of data collections for the purpose of understanding health status came from John Grant. In 1662, he published natural and political observations upon the bills of mortality by studying London death data for the previous 75 years. Anthony van Leeuwenhoek. He was the first to observe bacteria and other microscopic organisms using a light microscope. Bernardino Ramazzini. In 1700, Bernardino Ramazzini, 1633 to 1714, published first comprehensive occupational health treatise. He is known as the father of occupational health. Era of epidemics, migration and discovery. Denis Diderot wrote. French philosopher Denis Diderot, 1713 to 1784, in his articles on man, emphasized the importance of infant mortality and the growth or decline of a population. In this article, the hospital Diderot outlined a public assistance scheme including old age insurance and medical care. Thank you very much. Allah Hafiz.